Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 Homeopathic Remedies for Syphilis. What is syphilis? Syphilis is one of the most dangerous sexually transmitted diseases caused by bacterium Treponema pallidum. This infection can spread from three types of sexual unions, namely oral, anal and vaginal. During first stage of the disease, if proper treatment is not strictly followed, if proper treatment is strictly followed, recourse to future complexities may be avoided. That is, this first stage of treatment of the first stage of disease is very, very important. If pregnant mother is attacked with syphilis, she may give birth to a still baby or baby with congenital syphilis. How does syphilis spread? When a healthy person performs coition, any type of the three mentioned above, without any guard, 3 condoms, etc., with another person suffering from syphilis, the former is infected with the disease. Syphilis does not spread from any article like towel, pen, mouse, keyboard, etc. If mother gets syphilis during pregnancy, fetus gets infected, or at the time of delivery, if mother is infected, child is born with infection. Special note, nowadays syphilis screening test has been made compulsory for each pregnant lady during first and last trimesters, that is in all government hospitals and also registered nursing home. This has been made compulsory. Now on the right hand side, see, this is the Treponema pallidum in ordinary microscope and in electron microscope, and this is the ulcer that appears on the penis or on the vagina at the time of primary infection. This is called chancre, C-H-A-N-C-R-E, chancre, primary chancre. This is primary chancre. This will be talked about later on. Why do doctors call syphilis the great pretender? Most of the signs symptoms of syphilis are like other common diseases. Many have no soreness or pain. Most symptoms subsides automatically without any treatment. But in practice, if proper treatment is not done in the first stage, the disease spreads surreptitiously throughout the body, and in late part of life, say after 10 to 13 years, nerves, eyes, heart, liver, blood circulatory system, skeletal system, almost every part of the affected person shows malignancy. Furthermore, children born out of his or her blood are born with congenital syphilis, which is very difficult to cure. For all these reasons, doctors call syphilis the great pretender. The great pretender, mind the term. About 200 years ago, in 1828 AD, Dr. Samuel Hahnemann, the inventor of homeopathic system of medicine, predicted the nature of syphilis by his observation and experience of treatment of these patients. He also gave the mode of successful treatment of first stage of syphilis to ensure other stages, that is second stage, later stage, fourth stage, do not appear ever. Please note this very, very carefully. This is very important. This is very, very important. What are signs and symptoms of syphilis? Following signs and symptoms appear in 3 weeks to 3 months of first infection. Number 1, signs of primary stage, slightly elevated or depressed. Slightly elevated or depressed. Note this. This is elevated. This is depressed. Slightly depressed are seen ulcers. These are called ulcers. One or more ulcers are seen on the sites through which the bacteria Treponema entered the system. It may be glands penis, it may be tongue, it may be even vagina. These are called chancres. Many times these are not visible if they occur in anus or vaginal orifice or in uterus. These ulcers disappear spontaneously, whether treated or not. Pretension. Then the disease enters in the second stage. This is chancre on the tongue, and these both are, this is glans penis, this is body of the penis. What are signs symptoms of syphilis? Continuing, signs of secondary stage. Red or copper color rashes generally appear on palms, feet, back. Rashes do not itch. These may appear elsewhere like face, anus, vagina. Flat, big, small, white or gay colored warts may be seen in angles of mouth, perineum, armpit, groins. These are the second stage symptoms of syphilis. Continuation, second stage. Besides signs of skin, following are also seen in this stage. A. Fever, swelling of limb glands, throat pain, patchy hair loss from scalp, pain in head, muscle pain, loss of weight, tremendous tiredness. Note, this is the first time that some symptoms has appeared. Whether treated or not, these symptoms spontaneously recedes in a few months. Again, pay attention. You treat or not, this will go automatically, and the disease enters the stage of latency, that is latent stage. These are the symptoms of the secondary stage, terminal point of the secondary stage. Now latent stage signs. There is no symptom in this stage. No infection occurs from infected person so long this stage runs. But had the affected person been a pregnant woman, she may give birth to a still baby or congenital syphilitic baby. This is congenital syphilitic. Please note the face. And may suffer from a miscarriage. Frequently, in this stage, signs symptoms of the second stage return. Frequently, in this stage, signs symptoms of the second stage return, and this relapsing of second stage may occur more than once. Number 4. Tertiary stage symptoms. This is practically a destructive stage of the syphilis. After 1 year of initial infection of syphilis, this stage may appear at any time in life of the affected person. After 1 year to any time during life. Again, many may not experience this stage at all. Sometimes this does not appear. In this stage, brain of the person is attacked, showing neurosyphilis, dementia, tabes, etc. Person's eye are attacked, giving rise to ocular syphilis, uveitis. This is dementia. Dementia is a mental disease, actually affection of nervous system. Uveitis, blindness, etc. Again, his heart may show signs of cardiovascular syphilis, diseases of kidney, blood vessels, bone, in each case showing signs of extensive degeneration. Degeneration means destruction. What is the relation between syphilis and infection of HIV? This is another important thing. This was not there in the past days because HIV is a disease of modern times. In many advanced countries of the world, 50% of gay couples attacked with primary and secondary syphilis are seen to suffer from HIV. Note this point. 50% of gay couples who has attacked primary and secondary syphilis are seen to suffer from HIV. That is, if HIV is there, then this infection comes easily. Besides, from survey, it is noted that the probability of HIV negative gay couples of present days, which is HIV negative, to be attacked with HIV in future is considerably high. That is, gay couples is more exposed to this particular disease. I mean, the more this disease they have pre-inclination to be affected by this disease. If there are ulcers on genitalia in persons with syphilis, the rate of being infected with HIV of such person during coition is 2 to 5 times more than the others. Please read this thing, particularly who are gay. This is HIV, this is human immunovirus, under electron microscope. How they look. How syphilis is diagnosed? In past days, syphilis is diagnosed by direct visualization of Treponema pallidum. Treponema pallidum, you know the bacteria, with dark field microscopy. At present, the same is done by two types of blood test. Number one, non-treponemal test. This is VDRL. VDRL is Venereal Disease Research Laboratory Test. RPR, Rapid Plasma Reagent Test. B. Treponemal test. TPPA. Treponema pallidum particle assay agglutination. With this test, with all these tests, syphilis is diagnosed confirmedly that yes, this person is suffering from syphilis. When to consult a doctor? Syphilis and gonorrhea in some countries it's called CLAP, are two devastating sexually transmitted diseases of all sexually transmitted diseases. When one is confirmed that one has attracted one of these diseases, one must contact physician immediately. Modern allopathic medicine claims that penicillin is the remedy of their choice for syphilis and it is 90% effective. However, I am not sure of its effect as to combating the secondary stage, latent stage and tertiary stage symptoms. As to homeopathic medicine, Dr. Hahnemann himself personally researched over the total danger of both diseases for 15 years and chalked out a specific mode of treatment for the primary stage of syphilis as well as gonorrhea, and it had been assured from lakhs of cases that no stage of later period appeared ever after this treatment. This is true for all Hahnemannian homeopaths, not for practitioners of mixopathy. Mind this, Hahnemannian homeopath is a very selected group of doctors who still follow homeopathy according to Hahnemann's own instruction. I'm sorry to say that majority of persons are not following this. They are following mixopathy. That is, they give a mixture of too many medicines. This is not proper homeopathy. Proper homeopathy, that is constitutional homeopathy, or someone call it Hahnemannian homeopathy. These are the principles which have been laid down by the Hahnemann hundreds of years ago. Viewers must exert their discretion as to selection of the system of medicine to initial treatment of syphilis. Another very, very important line. Mark solve for syphilis: spreading and deeply penetrating ulcer on glands and prepuce, painful bleeding chancres with eolius fetid discharge, ulcer of glands and prepuce with lordaceous bottom and hard edges. Actually, one of the very important medicine to start with, Mark Sol. This is Hahnemann's Kastunker. This medicine was Hahnemann's Kastunker. Mark iode rubrum for syphilis. Hunterian hard chancres. The hard chancres are also called Hunterian hard chancres. Threatened gangrene of the glands of paraphymosis. Soreness of bones of the face. Sharp shooting stitches in the ends of penis through the glands. Old buboes discharging for years. These cases required Mark iode rubrum. Mark dull, Mark means mercurius, dulcis for syphilis, broad, moist, burning condylomata. This is condylomata. Around female genitalia, external genitalia, perineum, anus with extreme fetor, copper color eruption with spot over whole body with dry papule in center and from which skin exfoliates from center to periphery. Mark core for syphilis, regular indurated Hunterian chancre, hard chancre with lordaceous bottom. Lordaceous means this looks like cheese. Swelling and redness of nose, ozina. Ozina, you know, the destructive disease of the nose. The whole nasal structure is destroyed. This is actually a syphilitic feature. Let's test syphilis feature. Margins of the soft chancre, dark red, painful, easy bleeding, phagedenic ulcers, the ulcers which are destroying structures, phagedenic. In mouth, gum, throat, which halitosis. Halitosis means bad breath. Calibicrom for syphilis. Indurated chancres, deep ulceration, pricking and itching in glans penis, glit, with stringy or jelly-like copious discharge. Syphilitic affections of mouth and fauces, ozina nasalis. This is ozina nasalis. That ozina and ozina is the same thing. Destruction of nasal structures. Lump of hard green mucus hooked up from posterior nares in the morning. Bone pain with sharp needles like pricking. Pustular syphiloderma with tendency to coalesce and form scabs along with pus secreting ulcer beneath. Lachesis for syphilis. Ozina syphilitica. Same thing. Ozina syphilitica. Long-lasting redness of nose. Aphonia syphilitica. Phagedenic soft ulcer and soft palate. Phagedenic of phagedena, not phagedenic. Phagedena means this is a disease. This is phagedenic is the adjective. Phagedena is noun form. Phagedena of soft palate and fauces. Fauces is throat. Ulcers with blue borders. Nightly bone pains. Phagedenic chancre. This is phagedenic chancres. This is picture is given here. Conia maculatum for syphilis, indurated chancre of long standing, syphilitic sarcocele, swelling and induration of testicles with cutting pain through scrotum to root of the penis, pressing and tearing pain in testes. Causticum for syphilis, vesicles under prepuce changing into suppurating ulcers, bulbous secreting an acrid corrosive ichor with general systemic illness like gout, arthritis, etc. Phagedenic chancres discharging watery green acrid fluid with jerking pains. Subject restless at night, especially legs moved continuously. Mind the symptoms. Legs move continuously, you see in various. This symptom actually causticum. Sensitive to both heat and cold. Feel better in damp wet weather from warmth of bed and gentle motion. This is feeling better. Phytolacca for syphilis. Secondary syphilis, ulcers in throat, genitals. Syphilitic rheumatism. That is rheumatism whose origin is related to syphilis. Pain seeps, joint swollen, red, periosteum affected, pains in the middle of long bone or attachment of muscles. Worse at night. In worse at night, peculiarities of syphilis. In damp wet weather, ulcers as if punched out with lardaceous bottom. Lardaceous, the same, cheese-like. Weakness and prostration, but no paralytic weakness. Please mind this weakness and prostration is there, but this pain, this weakness is in a paralytic state, not paralytic. Nitric acid for syphilis. Phagedenic chancres, ulcers in urethra with purulent or bloody mucus discharge. Moist cauliflower-like condylomata. Syphilitic ulcers in mouth. Syphilitic epilepsy with melancholia. Subject sweat, urine, feces, breathe, everything foul. Disposed to dark bleeding, bone pains at night, worse from change in weather. Mind this particular term has come many times here. Phagedenic ulcers. Now, what is exactly this? A large rounded ulcer with undermined edges and is filled up with a wet gangrenous slough, in which fusiform bacilli and spirochetes predominate in the bacterial flora. This is phagedenic ulcers definition. With this, the video ends. Please mind this. I have not remarked anywhere previously with reference to any of my videos, but for this video I am telling, whoever you may be, while you reading this, you may be a doctor, you may be a practitioner in other pathies, or you may be a viewer, ordinary viewer. Please remember, this type of video is seldom seen in this open places, that is in YouTube or any other places in the internet. Please remember this. This is a very, very extraordinary type of video. I would request you to please keep a copy. That is, you please download this whole video and read it and read it. Thanks for listening and viewing. If any problem is there, please write down in the comment section. I will certainly respond.